Question 1. A 28-year-old woman reports irregular menstrual cycles, hirsutism, and acne. The nurse suspects polycystic ovarian syndrome, PCOS. Which of the following findings supports this diagnosis? A. Low LH and high FSH. B. High LH and low FSH. C. Low estrogen and high progesterone. D. High prolactin and low TSH. Answer: B. High LH and low FSH. Rationale: PCOS is characterized by increased LH-FSH ratio, leading to anovulation and hyperandrogenism. Strategy: eliminate hormone combinations inconsistent with PCOS. Remember, high LH drives androgen excess. Question 2. A nurse is teaching a client about signs of ovulation. Which symptom indicates ovulation? A. Thick, white vaginal discharge. B. Cervical mucus that is clear and stretchy. C. Vaginal dryness. D. Breast tenderness and amenorrhea. Answer: B. Cervical mucus that is clear and stretchy. Rationale: during ovulation, estrogen rises, making cervical mucus thin, clear, and egg white in consistency. Strategy: know that progesterone causes thick mucus, estrogen causes thin mucus. Question 3. A 35-year-old client presents with severe pelvic pain, dysmenorrhea, and infertility. Which condition does the nurse suspect? A. Endometriosis. B. Ovarian cyst. C. PID. D. Fibroid uterus. Answer: A. Endometriosis. Rationale: endometriosis causes endometrial tissue growth outside the uterus, leading to pain and infertility. Strategy: link cyclic pelvic pain and infertility with endometriosis. Question 4. A nurse cares for a patient receiving oxytocin for induction. Which finding requires immediate intervention? A. Contractions every 3 minutes, lasting 60 seconds. B. Fetal heart rate of 90 bpm. C. Moderate variability on fetal monitor. D. Uterine resting tone between contractions. Answer: B. Fetal heart rate of 90 bpm. Rationale: bradycardia, less than 110 bpm, indicates fetal distress, stop oxytocin and notify the provider. Strategy: always prioritize fetal well-being, low heart rate equals emergency. Question 5. A post-hysterectomy patient reports shortness of breath and chest pain. What should the nurse do first? A. Encourage deep breathing. B. Assess incision site. C. Check oxygen saturation and notify the provider. D. Administer pain medication. Answer: C. Check oxygen saturation and notify the provider. Rationale: chest pain post-op may indicate pulmonary embolism, a medical emergency. Strategy: always assess and act when life-threatening symptoms appear. Question 6. Which contraceptive method offers protection against sexually transmitted infections, STIs? A. Oral contraceptive pills. B. IUD. C. Condom. D. Diaphragm. Answer: C. Condom. Rationale: condoms are the only contraceptive method that also prevent STIs. Strategy: remember, condoms equals contraception plus protection. Question 7. A woman with premenstrual syndrome, PMS, asks how to reduce symptoms. The nurse should recommend: A. Increasing caffeine intake. B. Decreasing exercise. C. Increasing complex carbohydrates and reducing salt. D. Avoiding all physical activity. Answer: C. Increasing complex carbohydrates and reducing salt. Rationale: balanced diet, reduced salt, and regular exercise decrease PMS symptoms. Strategy: eliminate unhealthy options first. Question 8. Which of the following is a risk factor for cervical cancer? A. Nulliparity. B. Late sexual debut. C. Multiple sexual partners. D. Oral contraceptive use. Answer: C. Multiple sexual partners. Rationale: HPV infection from multiple partners increases cervical cancer risk. Strategy: HPV is the key risk factor. Question 9. A client is prescribed combined oral contraceptives. The nurse should instruct her to report: A. Weight gain. B. Spotting between periods. C. Severe leg pain. D. Mild nausea. Answer: C. Severe leg pain. Rationale: leg pain may indicate deep vein thrombosis, DVT, a serious side effect. Strategy: use aches, mnemonic, abdominal pain, chest pain, headaches, eye problems, severe leg pain. Question 10. A nurse provides care for a client with uterine fibroids. Which symptom is most common? A. Amenorrhea. B. Heavy menstrual bleeding. C. Vaginal discharge. D. Pelvic infection. Answer: B. Heavy menstrual bleeding. Rationale: fibroids cause menorrhagia, heavy menses, due to increased uterine surface area. Strategy: think fibroids equals heavy flow. Question 11. A client taking clomiphene citrate, Clomid, should be taught that the goal of this medication is A. To suppress ovulation. B. To induce ovulation. C. To regulate periods. D. To reduce bleeding. Answer: B. To induce ovulation. Rationale: clomiphene stimulates ovulation in women with infertility. Strategy: clomiphene equals fertility drug. Question 12. A nurse is counseling a client with menopausal symptoms. Which advice is appropriate? A. Increase caffeine for energy. B. Wear layered clothing. C. Avoid weight-bearing exercises. D. Increase salt intake. Answer: B. Wear layered clothing. Rationale: layering helps manage hot flashes and temperature fluctuations. Strategy: promote comfort and bone health in menopause. Question 13. Which finding is associated with pelvic inflammatory disease, PID? A. Painless vaginal discharge. B. Lower abdominal pain and fever. C. Amenorrhea. D. Vaginal dryness. Answer: B. Lower abdominal pain and fever. Rationale: PID causes inflammation from ascending infection, pain, tenderness, fever. Strategy: pain plus fever plus discharge equals PID. Question 14. Which hormone is primarily responsible for maintaining pregnancy? A. Estrogen. B. Progesterone. C. FSH. D. LH. Answer: B. Progesterone. Rationale: progesterone stabilizes the uterine lining for implantation and maintenance. Strategy: progesterone equals protects the pregnancy. Question 15. A client using an intrauterine device, IUD, should report A. Light cramping after insertion. B. Missed period or late menses. C. Spotting between cycles. D. Increased cervical mucus. Answer: B. Missed period or late menses. Rationale: may indicate pregnancy, risk of ectopic pregnancy with IUD. Strategy: always assess for pregnancy-related complications. Question 16. The nurse teaches a client about breast self-examination, BSE. The best time to perform BSE is A. On the first day of menstruation. B. During ovulation. C. 7 days after menstruation. D. Anytime in the cycle. Answer: C. 7 days after menstruation. Rationale: hormone levels are lowest, minimizing tenderness and swelling. Strategy: 1 week after period is the golden rule. Question 17. A nurse reviews lab results for a woman with suspected ovarian cancer. Which marker supports the diagnosis? A. CA-125. B. SEA. C. HCG. D. PSA. Answer: A. CA-125. Rationale: elevated CA-125 is associated with ovarian cancer. Strategy: remember, CA-125 equals cancer antigen for ovaries. Question 18. A postpartum woman develops mastitis. The nurse advises her to A. Stop breastfeeding until healed. B. Continue breastfeeding from both breasts. C. Apply cold compresses only. D. Avoid fluid intake. Answer: B. Continue breastfeeding from both breasts. Rationale: frequent feeding prevents milk stasis, antibiotics treat infection. Strategy: milk stasis worsens infection, keep feeding. Question 19. Which symptom indicates toxic shock syndrome, TSS? A. Vaginal itching and burning. B. High fever and rash on palms and soles. C. Thick yellow discharge. D. Lower abdominal cramping. Answer: B. High fever and rash on palms and soles. Rationale: TSS results from Staphylococcus toxin, associated with tampon use. Strategy: fever plus rash plus tampon equals TSS. Question 20. A nurse is teaching about pap smear screening. What is the recommended age to begin testing for cervical cancer? A. At age 18. B. At first sexual intercourse. C. At age 21. D. At age 25. Answer: C. At age 21. Rationale: screening begins at 21 regardless of sexual activity. Strategy, memorize. 21 is the start line for Pap testing. Question 21. A nurse is teaching a client about Kegel exercises. The purpose of these exercises is to A. Strengthen abdominal muscles. B. Strengthen pelvic floor muscles. C. Improve uterine tone. D. Decrease back pain. Answer, B. Strengthen pelvic floor muscles. Rationale, Kegel exercises help prevent urinary incontinence and support pelvic organs. Strategy, think Kegel equals keep control. Question 22. A client with infertility is scheduled for hysterosalpingography. The nurse explains that this test A. Evaluates hormonal levels. B. Assesses uterine and tubal patency. C. Detects endometrial cancer. D. Confirms ovulation. Answer, B. Assesses uterine and tubal patency. Rationale, hysterosalpingography uses dye to visualize uterine cavity and fallopian tubes. Strategy, remember HSG equals H for hystero, S for salpingo, tubes, G for graphy, imaging. Question 23. A nurse provides discharge teaching after dilation and curettage, D&C. Which instruction is most important? A. Resume sexual activity immediately. B. Expect bright red bleeding for 2 weeks. C. Avoid tampons for 2 weeks. D. Take aspirin for pain. Answer, C. Avoid tampons for 2 weeks. Rationale. Tampons increase risk of infection, use pads instead. Strategy, think nothing in the vagina post-procedure. Question 24. A patient reports severe unilateral pelvic pain mid-cycle. Which condition is most likely? A. Dysmenorrhea. B. Mittelschmerz. C. Endometriosis. D. PID. Answer, B. Mittelschmerz. Rationale, Mittelschmerz is mid-cycle ovulation pain on one side. Strategy, Mittelschmerz equals middle pain equals ovulation. Question 25. A nurse suspects ovarian torsion. What is the priority nursing action? A. Administer analgesics. B. Prepare for emergency surgery. C. Encourage ambulation. D. Apply heat to the abdomen. Answer, B. Prepare for emergency surgery. Rationale, ovarian torsion compromises blood flow and requires immediate surgical intervention. Strategy, always act fast with sudden, severe, one-sided pain. Question 26. Which lab result confirms menopause? A. Low FSH. B. High FSH and low estrogen. C. High estrogen. D. Low LH. Answer, B. High FSH and low estrogen. Rationale, ovarian failure leads to decreased estrogen and increased FSH. Strategy, FSH flies high in menopause. Question 27. A woman using oral contraceptives reports she missed 2 pills in a row. The nurse should advise A. Stop the pills and wait for the next cycle. B. Take 2 pills today and use backup contraception. C. Discontinue and switch to injections. D. Take no action if asymptomatic. Answer, B. Take 2 pills today and use backup contraception. Rationale, missing pills increases pregnancy risk, use condoms for 7 days. Strategy, missed pills equals double up and back up. Question 28. Which statement about emergency contraception, Plan B, is correct? A. It must be taken within 72 hours. B. It causes abortion. C. It prevents STIs. D. It is ineffective in obese women. Answer, A. It must be taken within 72 hours. Rationale, emergency contraception delays ovulation, not abortive. Strategy, Plan B equals block ovulation, not pregnancy removal. Question 29. A nurse reviews a patient's Pap smear report showing low-grade squamous intraepithelial lesion, LSIL. What's the next step? A. Repeat Pap in 12 months. B. Perform hysterectomy. C. Start antibiotics. D. Begin radiation. Answer, A. Repeat Pap in 12 months. Rationale, LSIL often regresses spontaneously, monitor before aggressive treatment. Strategy, mild equals monitor. Question 30. A postpartum woman complains of heavy bleeding and a boggy uterus. What should the nurse do first? A. Call the provider. B. Massage the fundus. C. Administer oxytocin. D. Check the bladder. Answer, B. Massage the fundus. Rationale, uterine atony is the most common cause of postpartum hemorrhage. Strategy, firm the fundus first. Question 31. Which of the following is a contraindication for combined oral contraceptives? A. Acne. B. Hypertension. C. Dysmenorrhea. D. Irregular cycles. Answer: B. Hypertension. Rationale: estrogen increases clot and BP risk. Strategy: high BP? No pills. Question 32. Which symptom is most consistent with ectopic pregnancy? A. Bilateral lower abdominal pain. B. Unilateral pain with vaginal bleeding. C. Painless vaginal bleeding. D. Heavy clotting. Answer: B. Unilateral pain with vaginal bleeding. Rationale: implantation outside uterus causes one-sided pain and bleeding. Strategy: pain plus bleeding early in pregnancy equals ectopic. Question 33. Which condition is linked to HPV infection? A. Ovarian cysts. B. Endometriosis. C. Cervical dysplasia. D. Uterine fibroids. Answer: C. Cervical dysplasia. Rationale: HPV causes abnormal cervical cell changes. Strategy: HPV pap smear abnormalities. Question 34. A nurse caring for a woman on hormone replacement therapy, HRT, should monitor for A. Bone pain. B. Leg swelling or calf pain. C. Bradycardia. D. Night sweats. Answer: B. Leg swelling or calf pain. Rationale: HRT increases clot risk similar to oral contraceptives. Strategy: hormones equals risk for clots. Question 35. A woman presents with a fishy vaginal odor and gray discharge. What condition is suspected? A. Candida infection. B. Trichomoniasis. C. Bacterial vaginosis. D. Chlamydia. Answer: C. Bacterial vaginosis. Rationale: BV causes thin, gray discharge with fishy smell, positive whiff test. Strategy: gray plus fishy equals BV. Question 36. Which test confirms ovulation? A. LH surge detection. B. FSH test. C. Progesterone level on day 21. D. Estrogen level on day 3. Answer: C. Progesterone level on day 21. Rationale: elevated progesterone after ovulation confirms corpus luteum activity. Strategy: progesterone proves ovulation. Question 37. The nurse knows that tamoxifen is used to A. Stimulate ovulation. B. Treat breast cancer. C. Induce menopause. D. Prevent ovulation. Answer: B. Treat breast cancer. Rationale: tamoxifen is an estrogen receptor blocker in breast tissue. Strategy: tamoxifen equals tamper estrogen in breast. Question 38. Which assessment finding indicates possible uterine prolapse? A. Pelvic pressure and tissue protruding from vagina. B. Dysuria. C. Amenorrhea. D. Severe cramping. Answer: A. Pelvic pressure and tissue protruding from vagina. Rationale: weak pelvic support causes uterine descent into the vagina. Strategy: something falling out feeling equals prolapse. Question 39. Which intervention reduces risk for osteoporosis in postmenopausal women? A. Avoid calcium supplements. B. Engage in weight-bearing exercise. C. Drink more soda. D. Increase sodium. Answer: B. Engage in weight-bearing exercise. Rationale: exercise and calcium strengthen bones. Strategy: lift weight equals lift bone strength. Question 40. Which finding supports vulvovaginal candidiasis? A. Green discharge and odor. B. White, curd-like discharge with itching. C. Thin gray discharge. D. Yellow discharge with pain. Answer: B. White, curd-like discharge with itching. Rationale: candida causes thick, cottage cheese-like discharge. Strategy: curd equals candida. Question 41. A nurse is educating a patient about pap smears. Which statement shows correct understanding? A. I should avoid intercourse 24 hours before the test. B. I should douche before the test. C. I will schedule the test during my period. D. I should use vaginal creams before the test. Answer: A. I should avoid intercourse 24 hours before the test. Rationale: avoiding sex and creams prevents false results. Strategy: clean cervix equals clear test. Question 42. A nurse assesses a patient with endometrial cancer. What symptom is most common? A. Heavy menstrual cramps. B. Painless postmenopausal bleeding. C. Vaginal itching. D. Foul-smelling discharge. Answer: B. Painless postmenopausal bleeding. Rationale: any postmenopausal bleeding is abnormal, early cancer sign. Strategy: bleeding after menopause equals red flag. Question 43. A woman being treated for chlamydia should be advised: A. Avoid sex until treatment is complete. B. Continue sexual activity with condoms. C. Stop medication if symptoms improve. D. Take antibiotics for 3 days only. Answer: A. Avoid sex until treatment is complete. Rationale: reinfection risk is high, both partners need treatment. Strategy: no sex till both treated. Question 44. Which patient is most at risk for preeclampsia? A. 28-year-old with BMI 22. B. 19-year-old prima gravida. C. 30-year-old with gestational diabetes. D. 23-year-old multipara. Answer: C. 30-year-old with gestational diabetes. Rationale: risk factors include diabetes, obesity, and first pregnancy. Strategy: high BP plus high sugar equals preeclampsia risk. Question 45. A nurse caring for a woman in menopause understands that estrogen deficiency increases the risk for A. Anemia. B. Osteoporosis. C. Obesity. D. Hypertension. Answer: B. Osteoporosis. Rationale: estrogen maintains bone density, deficiency leads to loss. Strategy: low estrogen equals low bone. Question 46. Which hormone triggers ovulation? A. LH surge. B. FSH. C. Estrogen. D. Progesterone. Answer: A. LH surge. Rationale: LH peaks mid-cycle, causing release of the ovum. Strategy: L for launch ovulation. Question 47. The nurse educates about intrauterine devices, IUDs. Which complication must be reported immediately? A. Mild cramping. B. Missed period and pain. C. Spotting after insertion. D. Irregular cycles. Answer: B. Missed period and pain. Rationale: may indicate ectopic pregnancy or device displacement. Strategy: pain plus missed menses equals problem. Question 48. A woman reports painful urination, vulvar itching, and green frothy discharge. What infection is suspected? A. Candida. B. BV. C. Trichomoniasis. D. Gonorrhea. Answer: C. Trichomoniasis. Rationale: caused by Trichomonas vaginalis, green frothy discharge and itching. Strategy: green and frothy equals trick. Question 49. Which of the following is a priority nursing diagnosis for a woman with severe dysmenorrhea? A. Risk for infection. B. Acute pain. C. Impaired mobility. D. Disturbed body image. Answer: B. Acute pain. Rationale: pain is the main complaint and nursing priority. Strategy: pain always first unless life-threatening issue exists. Question 50. A nurse teaching about breast cancer prevention should include which instruction? A. Limit alcohol intake. B. Avoid exercise. C. Eat high-fat foods. D. Avoid screening if asymptomatic. Answer: A. Limit alcohol intake. Rationale: alcohol increases breast cancer risk, lifestyle modification helps prevention. Strategy: less alcohol, less risk. Amazing work! You just completed 50 advanced NCLEX questions on female reproductive health. Don't forget, mastering these concepts means mastering the exam. If you learned something new, hit like, subscribe, and share with your nursing buddies. This is Nclex made easy 91, making NCLEX easy, one concept at a time.